I went to undergrad in Los Angeles, and it was already far from home in Hawaii, so I really wasn't thinking I would venture any further away. Columbia came onto my radar. I was really interested in the collaboration they were doing with the medical school curriculum.
So we started out with our first 18 months actually working side by side with medical students.
We're really incredibly fortunate that we have such a close interaction between our medical and dental schools, essentially living in the same campus, going to the same classes, seeing patients in the same facilities. It puts us in a position that very few others have.
This provides them with an incredible biomedical science base that really makes them some of the strongest dental students in the nation.
People have multiple diseases that interact.
There's definitive research-backed evidence that oral health care and systemic health care are intertwined tremendously, both for cardiac disease, now they're saying for Alzheimer's, diabetes, multitudes of items.
We need the workforce that is better equipped to look at the patient as a whole.
No one profession knows enough.
The practice of healthcare is evolving, and there once was a time where dentistry was really just a cottage industry of solo practices siloed around the nation. That's no longer the case. The most effective way of treating patients now is really collaborative care, and that involves all health services, including our physicians, our nursing services, whatever is necessary to take care of the holistic care of the patient.
A new development is our integration with the medical center's electronic health record. Having data about the patients, it really improves communication among providers and supports interprofessional collaboration.
We ask them to think about things that are not related only to their profession. So aging and end of life, healthcare justice, spirituality and health.
We have 17 different schools at Columbia University. That's a lot of firepower, a lot of opportunity to collaborate.
You either have two approaches to medical, dental, or health education. One, it is just basically to train providers, and that's okay. The other side of it is to train people who are actually going to move the disciplines forward and improve society's outcomes on health and oral health. And the only way to do it is through research.
Research is definitely stressed here at Columbia. The opportunities to pursue research are vast and endless.
Without research, there is no better society. In order for us to establish policy, we need to have data.
To come up with new treatments, new prevention strategies. I think that's fundamental to what being at a research university is.
Any sort of interest that you have, you're able to find someone here who is interested in that same thing and willing to mentor you.
In our office, we kind of model our core values and try to align them with the university's core values, attempting to welcome every student that comes into our school, supporting them in a way that takes into account their culture, their background, and their experiences.
Diversity at this university contributes to the strength of our service, the strength of our education, and ultimately the strength of our research.
It also means that we're learning and listening so that we can understand differences in perspective, bridge across those differences so people feel welcome here at all times, both patients, students, faculty, staff.
What really seriously drives my passions is mentorship. I've been a beneficiary of some significant mentorship to get me here, and I know what it takes, what these students need to hear and what they need on a real-time, ongoing basis, and make sure they feel empowered and make sure they're walking around with their head up so that they can recognize all of the opportunities that might take them in one path or another. They'll miss it with their head down, not feeling like they belong in the place.
we have an opportunity, but also a responsibility to lead at a time where showing how we can come together matters more than it ever has before.
What we will ultimately get to is this place where our faculty, our staff, and our students all reflect the community that we serve.
So here we try to teach people things that will last for the rest of their career, how to stay at the forefront of their profession, how to listen to their patients, and how to care for themselves.
We believe that the reason to come to the College of Dental Medicine is because you want to ultimately be a leader in the profession.
Our value system is the value system of the university, which is to create knowledge, to create thought leaders, and to expand that knowledge beyond our four walls to have an impact on society.